Effect on anti-CD4 antibody UB-421 on HIV rebound after treatment interruption. First, what is HIV? Acquired immunodeficiency syndrome, or AIDS, is a chronic, potentially life-threatening condition caused by the human immunodeficiency virus, the HIV. By damaging your immune system, HIV interferes with your body's ability to fight the organisms that cause disease. HIV is a sexually transmitted infection, or an STI. It can also be spread by contact with infected blood from mother to child during pregnancy, childbirth, or breastfeeding. Without medication, it may take years before HIV weakens your immune system to the point that you have AIDS.
The human immunodeficiency virus, or HIV, attacks the body's immune system. If left untreated, the disease progresses to its most severe stage, AIDS. HIV is an enveloped virus containing two identical strands of positive-sense linear RNA, along with several enzymes. Transmission can occur following exposure to infected blood and other bodily fluids. Once inside a person's body, the HIV virus infects specific cells in the immune system, called CD4 T cells, which is then forced to produce many new copies of HIV. These new viruses are released and go on to infect other CD4 cells. The CD4 T cells are destroyed, which compromises the immune system. Flu-like symptoms are usually experienced within 2 to 4 weeks of infection. A person with chronic HIV infection may have just progressed with mild to absent symptoms in the first few years, and oftentimes will be unaware of the infection. If left untreated, HIV can progress to AIDS, which is associated with opportunistic infections. If severe, these conditions can result in certain cancers and eventually death.
Now, what is antiretroviral therapy? ART are medications that treat HIV. The drugs do not kill or cure the virus. However, when taken in combination, they can prevent the growth of the virus. When the virus is slowed down, so is HIV disease. Antiretroviral drugs are usually used in combinations of 3 or more drugs from more than one class.
In the early 1980s, when the HIV/AIDS epidemic began, patients rarely lived longer than a few years. But today, there are many effective medicines to fight the infection, and people with HIV have longer, healthier lives. There are 5 major types of medicines. Reverse transcriptase, RT, inhibitors, interfere with a critical step during the HIV life cycle and keep the virus from making copies of itself. Protease inhibitors, interfere with a protein that HIV uses to make infectious viral particles. Fusion inhibitors, block the virus from entering the body's cells. Integrase inhibitors, block an enzyme HIV needs to make copies of itself. And multi-drug combinations, combine 2 or more different types of drugs into one. These medicines help people with HIV, but they are not perfect. They do not cure HIV/AIDS. People with HIV infection still have the virus in their bodies. They can still spread HIV to others through unprotected sex and needle sharing, even when they are taking their medicines.
Now, the applications in medicine. UB-421, the administration of a single broadly neutralizing human immunodeficiency virus, or HIV, a specific antibody to HIV-infected persons leads to the development of antibody-resistant virus, in the absence of antiretroviral therapy. It is possible that monotherapy with UB-421, an antibody that blocks the virus binding site on human CD4 T cells, could induce sustained virologic suppression, without induction of resistance in HIV-infected persons after analytic treatment interruption.
We begin with a major medical study that could be a game changer in the global fight against HIV. It finds that drug treatment alone may be the best defense to stop the spread of the virus. The findings are published in the medical journal The Lancet, and it could have huge implications around the world. Renee Filipponi joins us now from London. Renee, tell us what is in this landmark study.
Well, John, this is the strongest evidence at this point that shows drug treatment, specifically antiretrovirals, can stop the transmission of HIV. Now, the study took place over 8 years, included nearly 1,000 gay male couples where one partner had HIV. Now, the person with the virus was on these suppressive antiretrovirals, and despite having unprotected sex with their partner, there were no cases where HIV was passed between the pair. Now, there have been studies on this before looking at heterosexual couples, but researchers say this one settles any doubts. Now, antiretrovirals are basically a combination of drugs that are taken every day to stop HIV from replicating in the body, and over time, it reduces the amount of the virus in the blood to levels that are undetectable. It is not, however, a cure. Now, researchers involved in this study say that the drug treatment prevented nearly 500 HIV transmissions during the 8 years of the study. Have a listen to what the lead researcher had to say about the findings and the risks.
So the very worst case scenario is that you would have to have condomless sex for 437 years before you would have the outside possibility of a transmission. So, yeah, it's conclusive.
Okay, a landmark study, so let's talk about the implications.
Well, this will have major implications on the global effort to stop the spread of HIV, and that spreading the virus is more manageable than ever thought before. Now, the push is that all people have access to testing and treatment, and some researchers are also looking at this and suggesting that uninfected people can also take steps to protect themselves if they take a particular antiretroviral preventatively. Now, access to these drugs, also called pre-exposure prophylaxis or PrEP, are expensive in Canada, and availability is uneven. So in some places, people even have to pay out of pocket to get them. So HIV advocates are going to use this study and use it to help push change and help end the stigma against people with the virus. And it's important to note here, John, HIV is still a serious health concern. And in fact, every year, Canada still sees as many as 3,000 people infected with the virus.
Renee, thanks for this. CBC's Renee Filipponi in our London Bureau.
Now, the pros and cons. The UB-421 maintained virologic suppression during the 8 to 16 weeks of study in participants in the absence of ART. But in the cons, future studies are warranted to determine the longer-term safety and efficacy of UB-421 in HIV-infected persons. This issue applied in Ecuador. The Ministry of Public Health of Ecuador delivers monthly and regularly antiretroviral drugs to all people living with HIV/AIDS and required treatment. Access to medications, exams, counseling, and promotion is free and in accordance with the constitutional precepts. In conclusions, monoclonal antibodies have been explored for the treatment of HIV infection. However, attempts to use broadly neutralizing HIV-specific monoclonal antibodies to substitute for ART remain a formidable clinical challenge, given the emergence of antibody-resistant virus. 5 ways to prevent HIV. Always wear a condom. HIV is spread through blood, semen, preseminal fluid, vaginal fluid, and rectal fluid. You can get it through vaginal, oral, and anal sex. Condoms reduce the risk of the virus spreading. Get tested. 45% of Americans have never had an HIV test. The CDC recommends that everyone ages 13 to 64 be screened at least once. Talk about HIV status with your partner. Limiting your number of sexual partners can decrease your risk, but also can understating the sexual history of your partners. Before having sex with someone new, ask if they have ever tested positive for HIV or another STD and how many partners they have had between those tests. Don't share needles. HIV can be spread through blood. Injecting drugs with shared needles puts you at risk. And consider preventive medication. People at high risk of contracting HIV might consider suppressing a deadly preventive medication called pre-exposure prophylaxis or PrEP, which can help prevent the virus from spreading. Now, how do we end the HIV epidemic in the US and in other places? Immediate effective treatment is the key. People with HIV need to take HIV treatment as soon as possible. Taking HIV medicine as prescribed can keep the amount of virus in their body very low, called viral suppression or suppressed. People who stay virally suppressed or undetectable can live long, healthy lives and have effectively no risk of transmitting HIV to others through sex. About half people with HIV in the US are virally suppressed, and 1 in 7 people with HIV don't know they have it. What can healthcare providers, people with HIV, and communities do to prevent new infections? Well, for more extended answers, you can visit this website.